Welcome to Financial Insider Weekly. I'm your host, Michael Gray, CPA. My guest today is Don Pollard. Don is a chartered life underwriter and a chartered financial consultant, and he is an independent insurance broker located in San Jose, California. His company is called Advanced Professionals. His practice offers individual insurance, Medicare supplement, employee benefits, and executive life and disability insurance planning. Don has worked in the insurance industry since 1973. He's managed insurance agencies and trained agents, past president of the Silicon Valley chapter of the National Association of Insurance and Financial Advisors, and he currently serves as its national committee person. Today, Don and I are going to be giving an update related to health insurance for individuals. We're sort of a progress report on healthcare reform. As we get started, I want to caution our viewers, because some of our viewers are not in California, that the rules for medical insurance vary from state to state. For example, California has its own exchange. Some states have their own, they're borrowing the federal exchange, which had its own bunch of headaches. Anyway, so be sure that you're working with a consultant who's familiar with your state laws. Don, thanks for joining me today.
You're welcome, Mike. Thanks for having me here.
Okay. So, how are things coming with this Covered California program? We've got, I guess, 3/4 of a year under our belt, getting ready for renewals and so forth. So what's happened?
So I think a progress report is what you called it, and I would say, there's two types of progress here. The type that the head of the whole thing wants to report, and then there's the type that people like myself get involved in, which is the nuts and bolts and the actual day-to-day of getting the work done. But the overall effort has been, I think, a tremendous success relative to the original objectives of the plan, which was to get people who are uninsured the ability to get insurance. Peter V. Lee, who is the head of this whole thing, he reported in September that enrollment in the exchange is over 1.2 million people in the California exchange, and combined with the new Medi-Cal enrollees, it's about 3.1 million people, so 1.9 million people enrolled in Medi-Cal through the exchange process. So from that perspective, it's been a resounding success, in my opinion. Ken Jacobs, who's the chair of the Labor Center at UC Berkeley, estimates that 39% of the current enrollees did not have health insurance previously. That's almost 500,000 people. So from that standpoint, it's been, again, wildly successful. When they try to assess the numbers of people who are covered through the exchange and whether they had insurance or they didn't have insurance, Michael Weinberg, who's a senior policy advisor at the Bay Area Council, recently described the exchange as enrolling people who are frictionally uninsured, and by that they mean that due to specific situations they may go in and out of having medical insurance coverage, and this is a concept that they identify as churning. And what he reports and says is that the exchange and the Medi-Cal accommodation process is creating economic security for moments in people's lives when they do go through transitions. So again, from that perspective, it's been tremendously successful in creating a stronger safety net. It's clear that the whole process has made a tremendous impact in the uninsured population that we had before, and they are now in the process of thinking about things they can do to improve enrollments beginning November.
So next we're going to get into talking about ongoing problems, but it seems to me that part of what's going, as you said, there's a very heavy enrollment that's happened in Medi-Cal, and my son, unfortunately, is one of them, as you know. And our impression is that that system is sort of being overwhelmed.
Well, you brought up ongoing problems, and that is clearly one of the current ongoing problems is the tremendous backlog of Medi-Cal applications. In fact, as of July of this year, there was 900,000 people who had applied for Medi-Cal that their applications have not been processed. Now, Medi-Cal itself says that roughly 50% of those are people who have applied within the last 45 days, which is their allowed time frame to process someone's application. I don't know whether that's true or not, but in any case, that still leaves 450,000 people who are waiting longer than the appointed period of time.
Yeah, the issue isn't just getting enrolled; it's getting served. It's finding the doctors to take care of all of these people. And,
well, Medicare reports that basically there is a process for that. You just show up and tell them that you're in the process of doing it, and it's all going to work out. And it's kind of one of those trust me deals, right? Where they say, this is how you do it, and trust me, it'll work out. Which I know to many people that's a little scary, and it's not the best of situations, but that's where they are now. You're right. They had no contemplation that it was going to work out in this way. Another one of the ongoing problems is we've had a lack of Latino participation, which clearly is important in our state.
That's really strange.
And they can't figure that out. They've done studies, obviously, as to what was wrong with the original process. One of the things they figured out was that most people prefer face-to-face counseling relative to this kind of purchase, and they've decided finally that there's no such thing as one touch and done, which many probably could have told them in the first place. So the efforts moving forward will be toward the Latino population, and then also in promoting, obviously, enrollment in the system.
Okay. So what are the things? Well, before we move on, I'll just another comment, because basically, like what my son has experienced is calling some of these places that are supposed to be serving, and basically they're saying no room. We're handling all the Medi-Cal patients that we can or are willing to, and so it makes it very frustrating, when you're trying to figure out who's going to take care of you.
Absolutely, and they actually in Santa Clara County we have 3 different options for the Medi-Cal administrator. You have Anthem, which I know you know, and then there's also Kaiser, and then the Santa Clara Valley Health Plan. So that should be something I should look into for you tomorrow when we get finished with our time.
I thought that the Santa Clara County one would be a good choice, because they're showing just tons of providers, on their list. But then when you follow up with some of these people, it's like, we've got all that we can handle. We're sorry, we don't have a room for you. So,
I'll tell you from an agent's perspective, the problems that we face, aside from the resounding success of the program as a whole relative to the outcome, the problems that we face are for waiting on the phone for hours on end, to talk to anybody, and then when you finally ultimately talk to them, they may or may not be able to make something happen to where you don't have to call them back again. And that's very frustrating for a person like myself who views their work as service to the customer and helping them get things done that they weren't unable to do, and that kind of thing. So that's very frustrating, and I have worked with the Medi-Cal people, they are, somewhat cooperative and helpful, and then the Covered California people, they are about the same. So I couldn't say that they got a better grade from me, an agent, in that respect. Now, from the perspective of ongoing, what are they doing to change the situation? They are reporting that they have roughly 700 people that work in the service center. This is Covered California, and as you know, you can enroll now in Covered California or Medi-Cal. In fact, this is the way you do it through the CalHERS website, which is the online processing system. So they have roughly 700. Open enrollment starts November 15th. They've said they're going to hire another 250 people to man those situations and to help in that crush. Now, that's not the Medi-Cal system, that's the CalHERS system.
Right.
They've also allocated roughly $46 million for advertising for the new open enrollment, and this is again an effort to make people aware of the process and how you do it. And then they've got an additional $48 million in community grants to organizations whose specific expertise is to go out and make inroads to community groups that are not being served. And I think this is going to speak to the Latino issue, is what they're trying to do, is to focus on those groups to pick that up. Now, whether these extra 250 people are going to solve that problem in the processing of these new people that are coming in, I couldn't tell you the answer. Medi-Cal has been told by the federal government that they need to step up their processing to get people approved. Now, again, that doesn't address the issue that you're having with your son relative to providers, but it does talk about the people that are out there that don't know whether they have insurance or not, or they don't know how to enter the system and process it.
Mm-hmm. Okay. So, what are the dates that we're dealing with now related to this?
Well, the critical dates now are probably November 15th through February 15th. Those are the next open enrollment period where everybody is welcome to come in. That period closed at in April of this year, and then you could only get in currently. You could only get into the system through a special enrollment period, which would be something like you lost your group insurance coverage and became eligible for COBRA, and it was really expensive, or you had some other kind of life event that allowed you in. November 15th, the doors open, everybody can come in no matter what happens, and then those plans will start on the 1st of January. So I think from that perspective, today is the most important. It is important to note that if you're a person who could qualify under the Medi-Cal system, that you can enroll at any time. There are no restrictions on enrollment for that. The only restrictions are through Covered California and the exchange, which purchases insurance through commercial insurance companies.
Okay. So just let people know, today is September 23rd, 2014, and so you'll see this sometime later, but just to give you a little reference for where Don and I are today, because things do change a little bit, from time to time. More information comes up. Well, who's participating in Covered California, individual and shop exchanges?
Things change every day.
Okay.
but these it's pretty set now, and in the California exchange, we've had in the individual side, we've had the larger carriers: Anthem, Blue Cross, Blue Shield of California, excuse me, Health Net, Kaiser, Sharp, Western Health. Those are the Northern California providers, and a few have decided not to do it. It looks like they have not decided to come in at this point. That's Aetna, Cigna, United Health. And the interesting thing about it is that Anthem decided not to participate in the shop, which is the small employer side of the exchange, and they only are in the individual exchange. And so far, their market share is at about 30%. You have Blue Shield at about 27%, Health Net 19, and then Kaiser 17. The rest pick up the rest of the piece. November 15th, however, the premiums will be increasing to start in January, which shouldn't be really a surprise to anyone. However, the amount of the increase may be a pleasant surprise, and in fact, Kaiser is the only carrier that we have in our exchange that the rates are actually going down, and I think that's probably a function of their lack of market share. They want to try to gain some of that back. So the rough premium increase, Anthem is announced 4.6%, Blue Shield at 6%, Health Net 14.9%, and then Kaiser at minus 1.4%.
Mm-hmm, mm-hmm. Okay, so how are the people signed up to cover California and the shop exchanges?
So again, the original intent of this whole thing was to do everything via the internet. So they were going to run all enrollments through there, and insurance agents had to fight to basically get to be a part of the program. And it turned out that insurance agents as a group enrolled 39% of the people that were in. 41% went through the actual website. 9% were enrolled by certified enrollment counselors, and then 9% just through the call center. Now, I will hurry up to tell you that many of the people that I signed up had already gone on to the Covered California website and tried to sign up, and they couldn't figure it out, or they couldn't make it work, or the thing crashed on them 100 times. And so they called me, and then I fixed it. Yeah, so I don't know how many of those things got counted twice or not.
Uh-huh.
But in any case, they are again proceeding forward. They've given up on the idea that it's going to be a one-touch option or deal. It's not going to happen, and so they're realizing that it's going to take multiple times interacting with people in order to get them insured.
So what if you are already covered by some sort of a plan, either individually or through your employer?
Well, I think it's the same as we talked about before. That hasn't changed, and that is that if you've got a plan through your employer, the thing to do would be to determine what kind of plan you have with the employer and what you pay for it, and then check with through the exchange or the Shop and Compare website that they have, and see if you can find a better arrangement on there. And if you do, then you could take the next step, which is to be, if you're able to switch to the exchange, then you could go ahead and do that. Now, I will tell you that employers, large employers over 50 employees, who are required to provide insurance for their employees, if they provide medical coverage for the individual employee that costs them as a premium share less than 9.5% of their income, their W-2 income, then they've complied with the law, and the employee is then ineligible for a subsidy through the exchange. So they could still buy the insurance through the exchange if it turned out to be cheaper for them, but they wouldn't qualify for a subsidy. Mm-hmm. So there's a couple of things that people need to be aware of. Certainly, my advice would be if you're not conversant in these things, is to get with somebody, either one of these advisors that they have trained, or with an insurance agent that can help you to figure it out. Because it's obviously much easier to do it that way than sit on the phone for hours on end.
Right. So what's going on related to the ability for the state insurance commissioner to reject excessive premium increases? And I guess there's some other another proposal on the ballot or something related to this?
Well, yeah, you haven't been watching much television lately, I guess. So we have the latest kind of ongoing effort to control premium increases here that are unwarranted, and Proposition 45 is on the ballot, and basically what it says is that if it passes, that the insurance commissioner in California will have the authority to approve or deny rate increases by the insurance carriers. Now, there's lots of argument on both sides of this thing, and the situation today is the insurance commissioner reviews in medical insurance. They review the premium increases to determine whether they're warranted or not. So based on the experience, based on the environment, the number of enrollees, and that kind of, and the expenses, are these increases warranted? And then they give an opinion. They do not have the authority today to reject the rate increase. And actually the insurance commissioner does have that authority in property and casualty insurance, homeowners insurance. So what this would do would kind of even up that score, and of course the insurance commissioner is in favor of this, along with many other groups. And then on the other side, there's of course the insurance companies that don't want that, and actually even the exchange has said that it's not necessary because the exchange is negotiating and those kind of things. So
yeah, so that's another question is we've got Covered California, which is our exchange.
right.
Do they do any regulation related to this, or how does it work?
Well, it's again, the exchange is a marketplace.
Mm-hmm.
And so the idea of that is that they say we are going to have X number of people enroll in here, and we want you to give us your best rates for this coverage. And then they have the 4 or 5 or 10 carriers, whoever's going to do it. They go back and figure out, based on what their assessment is of who's going to be in the thing, how much they're willing to charge. And so the head of the exchange feels that, well, this is our negotiating piece, and if we negotiate and the insurance commissioner then comes in and says, oh no, we're not going to accept those rates, that's going to in some way undermine their authority or their ability. I don't know, maybe it will, maybe it won't.
Are you sort of, is the exchange really the only way to go now for when you're getting medical insurance, or are there other alternatives?
No, you can still buy insurance commercially through the insurance companies.
Mm-hmm.
The exchange is the only vehicle that you can use if you want to qualify for a subsidy.
Mm-hmm.
On the premium. So if you buy your insurance just flat out from Kaiser or HealthNet or somebody, there's no possibility to receive a subsidy on that premium. You just have to pay the whole premium. Whereas Covered California, if you're under 400% of the federal poverty level, you're going to get your insurance at a premium that's been reduced by some amount. And that amount is calculated based on the size of your family, the zip code where you live, and your income.
Yeah, but a lot of people they're not in that income category, and so they're not going to get a subsidy, and so,
right. There's no necessity that
and they're not going to be they may not be penalized, or they shouldn't be penalized, because the programs that are offered, I guess, have to conform with the federal requirements.
Yeah, and the we talked last time about essential benefits and the basically metal tiers of the plans. So all plans now have to comply with that, other than grandmother or grandfather plans under the group insurance side. So basically anything that we would be eligible to get through the insurance company is going to have the same parameters, the same essential benefits, going to be the same metal tier kind of thing. Now, you may be able to have a certain additional benefits that might be thrown in, by any particular carrier or something like that. But basically, it's all pretty much the same. Again, the reason you would use the exchange is in order to qualify for the subsidy. And frankly, of the people that I worked with, 50% of them were executives that made way more than 400% of the poverty level, but they were out of work. So they lost their job. Their COBRA was sky high, and so this was a viable opportunity for them to come in and have, I'm going to say, interim insurance that's good insurance, that provides essential benefits, and receive some help from the government for that.
Okay. So, yeah, there's the thing, I guess, the pre-existing condition used to be a problem related to medical insurance. Has that sort of gone across the board, whether you get the commercial coverage or the cover California?
Totally gone.
Okay.
No.
So, the biggest thing that's going to be coming up too for people, the biggest change for this year is there's going to be actually some tax reporting that's involved. I don't think we really have time to get into it in detail. We only have a couple minutes left, but I guess I'll just tell people that even if you're not a high-income person, you may find that you need a little help this year to walk through that, and that you're going to be getting some information from the insurance companies that you're going to need for reporting related to this.
Right. Well, you may be talking about two different reporting requirements. Number one is if you received a subsidy.
Yes.
Based on what you told them initially at the beginning of the period when you enrolled, that's going to be verified electronically via your income tax return. So if there's a discrepancy between that, then you would need to either pay back or get more of a credit. Okay, so that's one piece. The other piece is the reporting part for whether you had insurance or not, relative to the penalty for not having insurance, because it is mandated that individuals must have insurance now. And again, the penalty this year, 1% of pay or $95. Not that big a deal, but it does grow to almost $700 or.
Yeah. Okay, folks, we're all out of time. Don, I want to thank you so much for joining me. We appreciate coming and sharing this important information with us. Folks, we'll see you next time on Financial Insider Weekly.